By way of comparison, this is the equivalent of 70% of Quebec's last annual budget, $122 billion, or more than 1.5 times the budget devoted to health in Quebec, $52 billion. Rising temperatures will mean more urban smog, ground-level ozone, across Canada, read the report released this month by the Institute, an independent and publicly funded research organization. The increase in death, disease and health costs follows the increase in ground-level ozone. If no action is taken, the costs of care related to ozone exposure could reach a quarter of the sums currently allocated to the care of people with cancer, warn the authors. By 2100, the costs of death and reduced quality of life would climb to $250 billion per year. At the end of the century, in a decade, respiratory illnesses linked to ozone could lead to 270,000 hospitalizations and premature deaths, more than the population of the city of Gatineau, illustrates the report. Besides smog, other elements can negatively affect air quality, such as forest fires, which are likely to become more frequent and intense, or higher concentrations of pollen, which can lead to more allergies and breathing problems. Another consequence of climate change is the increase in the number and intensity of heat waves, which can be fatal. According to projections, there could be 10 to 14 weeks where the temperature exceeds a safe threshold by the end of the century. Under a moderate emission scenario, heat hospitalization rates will increase by 21% by 2050 and double by 2100, the researchers warn. It is estimated that the annual costs related to deaths and reduced quality of life due to heat waves would be $3–4 billion within 30 years. Temperatures that are too high may also adversely affect productivity at work, especially for trades carried out outdoors. Under a high-emission scenario, climate change could cause 128 million hours of work to be lost per year by the end of the century, or the equivalent of 62,000 full-time jobs and nearly 15 billion people. Quote,